everyone. We are the Colors of Parenthood, and today we have a lovely guest, Stephanie. Stephanie, could you tell us a bit more about yourself? What do you do?
Sure. Thank you so much for having me. My name is Stephanie Straub. I live in the US in a city called Syracuse, that's in New York State. I am a licensed clinical social worker and I run a small group private practice performing psychotherapy with clients. And we specialize in all things maternal and perinatal mental health. So, supporting folks who are trying to get pregnant through their pregnancy, postpartum, miscarriage loss, and beyond.
Okay, sounds great. And how did you decide to specialize specifically in maternal mental health?
So I was working in for somebody else at a private practice, but I knew ultimately my goal was to um, open my own private practice at some point, and I was trying to make a good decision that felt good for me as a clinician, as well was a good business decision. And so I reflected on who were the clients on my current caseload that I felt most excited to work with, and it was the moms. And so I did a little bit of research and found ways to get some deeper, more specialized training in how to support um, women around their mental health around the perinatal period, and realized that there was a real gap in that specialized treatment in the area that I live. So it was a good decision for me clinically because it kind of lights me up, and it was a good business decision because there was a need. And as soon as I started kind of marketing myself as that, my phone hasn't stopped ringing since. That was like 7 years ago.
Okay, just saying that everywhere is a bit like there is a lot of need for specifically mental health practices for maternal mental health. So it's not only in your region. Fortunately, here there is not many specialists, so we still are working on that. So today we're gonna concentrate on some specific topics, and I just want to ask first: do you have a lot of clients that been through birth trauma, or
So, over the years of doing this work, I have definitely held space for women who have struggled with their birth experience. It's not always the reason that they come in, but we realize in our work that that has had an emotional impact and they haven't connected those dots. So, for some, absolutely 100%, that's what they're coming in the door to work on. And for others, we kind of come to the realization that that has had an impact on them by kind of peeling back the layers of their depression or their anxiety symptoms.
okay? And if you can separate the physical and emotional birth trauma, can you define them?
Um, so this is difficult to do specifically because, especially with birth trauma, and this is just my personal and professional view on it, is trauma is in the eye of the beholder. And what I mean by that is somebody can have what's considered a perfectly normal birth experience. And for them, it felt traumatic. And somebody can have what others would think is a traumatic birth experience, and they aren't emotionally or mentally impacted by that. So it's really hard to define like what constitutes birth trauma because it's really dependent on how the individual perceives that experience.
Yeah, I think probably that's the same with every sort of trauma, that it's really hard to label and put it in a box like a diagnosis. Yeah, you have the symptoms. So we diagnose you with post traumatic stress disorder, for instance, or something like that.
Yes.
Because when I speak with moms, some of them are telling me like I don't want to say I have birth trauma because I'm not sure, but definitely it was awful. And she started saying and being really emotional when sharing her story about the bird. So it's like a bit of a, they feel a bit judged even though nobody's judging them. Like, I don't want to say I have birth trauma, but my experience was traumatic.
Yes. So I mean, in kind of very general layman's terms, I look at anything that could cause real or perceived um, threat or harm to oneself or now a child. I mean, anything that falls under that umbrella. So it doesn't even have to be that you are actually at risk of significant um, physical concerns, but it could be just that that's your fear, your perception of it. So that's enough for me, for somebody to, if they say that that was their experience, even if that wasn't the actual case, that's enough for me to say, yeah, that felt traumatic for you. But I think you're right in that a lot of people get hung up on that word of trauma. And there's two reasons that I think people do that. For one, is we do this thing that's sometimes called comparative suffering. So we can look at um, some of the atrocities that are happening in our world and then feel like, wow, do I really have a position? Am I really in a position to complain about this trauma that I've experienced? So I think sometimes people feel guilty calling their experience trauma because it's not as bad as other things that we would collectively call, traumatic. And I think the other thing is there is, and even under the best of circumstances, there's this thing of, well, as long as baby is happy and healthy, that's all that matters. And so it kind of invalidates the mother's experience because now all the focus is on baby. And not to say baby's, physical well-being and health and happiness isn't important, but you can't have that without mom being okay. And but that's not kind of what societally is the greater understanding. And so I think that that's another reason why folks are really reluctant to call their birth experience traumatic.
Yeah, and what struck me also is that mothers usually say they feel really guilt and they're embarrassed by some thoughts they have about, I just want this pain to be over, even though, for instance, they're doing something that is not the most like healthy way to do in when they're delivering the baby or after delivery for the baby. And it's like, but it's normal to be a human being also, not only a mom, even though you just started being a mom. So
Yeah.
it's a really tricky thing to how to help mothers don't feel this judgment and guilt when it's just like a human being thing.
Well, if I can share a little personal anecdote, right? Um, so I think there is this expectation that when you become a mother, you also kind of are become a martyr to the care and well-being of your child. And I just remember, like, what literally in the first moments, and this is going to be like maybe a little TMI, but of having to be after delivering my first child, having to be stitched up because there was a tear. And I remember, like, they were taking care of my baby in the little warmer and looking over at her thinking what I now know was irrationally that the endorphins I got from looking at my newborn baby was going to make this pain go away. And it so didn't. It was a very uncomfortable experience. And just that whole thing that, like, wait a minute, I thought this is part of the package, that the joy I get from this child is supposed to just erase all other the troubles in my life. And that was literally in, like, the first 5 minutes of parenthood that I was like, oh, that's not what this does. Like, all my joy doesn't come from this child. Um, and all my happiness isn't rooted in her happiness. And I learned that lesson really quick. But it was a shock because that's kind of what we've been taught or socialized is the case. Yeah.
Yeah, that yeah, all of everyone. Even I am not a mom, but I have this expectation that that's the most wonderful day and everything should be fine after that. It's only one day that you're gonna go through it, the delivery, and everything will be fine. But coming to that, I hear a lot of moms are actually like have this recovery process, and it's not only physically but emotionally after giving birth. So what would you say? Do you happen to have a lot of clients having this, and how are some coping strategies, for instance?
Well, I think again, it's important to find a network of other women who you can trust are going to be real with you, who are going to be honest about the experience, and who are going to normalize um, things like how things really are. And so I think a lot of women are often really surprised by not feeling this like immediate outpouring of love and attachment and bonding with this child. But you just went through something really monumental physically. You're exhausted, you're mentally exhausted. And sometimes the first feeling is like, I'm so glad that's over, right? And it might take a while, hours, days, weeks even, to feel this connection, this bond. And for a lot of new parents, that can feel like, what's wrong with me? Am I some sort of monster? Is this indicative of how things are going to be, my connection with my baby for life? It can be really upsetting, but that's why it's so important to have connect with a network, whether these are real people that you know in your life, or ways that you can connect with resources online, to get the real story of what's common and normal. And so I think as much as we can do that during pregnancy and postpartum, I think it's very, very helpful to just make to validate everybody's individual experience.
Yeah, and to not feel alone, and to understand that this happens to other people as well. So you're not a bad mom. That doesn't mean anything. To not put a
Yes.
label on yourself.
Yes.
And I think the most difficult is for women that don't have this network. I agree. Not speaking from my personal experience, but even if I speak for me going through something, it's really helpful to have someone that's been through just a similar experience. Of course, we cannot find people going through the same thing, but I've heard women, moms, saying that mothers also can be really judgy. So you have to find a circle that you can trust, and yeah, it's tricky that as well.
Yes. Yes. So that's why I emphasize like finding people who can be real with you, because there's this fear of judgment, and because there's this stigma around struggles in new parenthood and new motherhood, right? People are afraid to share their authentic struggles for fear of that judgment, for fear of that stigma. And so that's why it's tricky, but you got to find at least one person who's willing to kind of um, let it all hang out, the good, the bad, the ugly with you. Yeah. Yeah. But
Yeah,
it is tricky because people are so afraid of judgment. But that's why having other resources online where there's maybe a little bit of anonymity helps too.
yeah. And if we go back to the birth trauma, would you say that you found some women are experiencing difficulties with bonding with their child after having a really difficult and traumatic delivery? Like, for instance, the mother has been 20 hours in delivery, and then an emergency C-section appeared. So that can be really traumatic.
Yeah. Yeah. I think what I have seen, and again, this is just kind of through my subjective research, right? Observations with my caseloads, is it goes one of two ways, right? So either it's two extremes. So it's either that mom really struggles to bond with that child because it's almost it's associated with this really traumatic event, this
Mhm.
this child, this baby, and or they're like super glued to that child because they were so fearful that something bad was going to happen, that they do not want to let that baby out of their sight, and they do not want anybody else's hands on that baby. They want to take back control because they lost so much of it in the birth experience. And in my experience as a therapist, I see more of that than I see of the lack of bonding. This isn't healthy either. But I see more of that in response to birth trauma, this like overcorrection of like, I almost lost the opportunity to mother this child, either because my life was in danger, child's life was in danger, or both. And so now it's like, I'm not going to miss a second. But that can be really, really detrimental to a new mother's healing and just their own general well-being. Yeah. And it can create a disconnect between, the other partner and the mom and the baby as well. If, if the father, if the mother isn't allowing the father to be involved because of her own anxieties, right? So now there's a disconnect between the father's ability to connect and bond and attach with this baby.
Yeah, and this really makes me think that it's not definitely talked about how birth trauma can affect the parenting. And overall, like I've seen now that there is a lot of talk about how to be a mother, how to be a great father, how to raise your child to have good nutritions and etc. and everything like that. But no one is actually saying that even the delivery process, so those how much hours, however, like 9 or 20 hours, are actually affecting how you're gonna parent your child afterwards as well, immediately after.
Yeah.
And this is shocking.
And something else that's not touched on is how it affects the partner. Because imagine being I'm just going to talk in language of like a male and a female coupling, right?
Okay.
So talk about that father witnessing, right, the person most important to them in the whole world going through something traumatic and potentially life threatening, as well as this baby that isn't even here yet, right? And the pressures that are put on men to like be, I'm brushing with broad strokes, but be solid and be strong and be the rock for their partner. And so it's like they don't get the luxury of struggling with this either. Right? They don't get the luxury. And then they have this additional stigma of like, and they're not really allowed to. They're not really allowed to have fears and emotions around that experience. So, and talk about feeling completely and utterly helpless and out of control.
Yeah, I can just imagine that. Definitely, there is also a lack of talks about how the father is experiencing it and how the partner, the other partner overall, whoever is it, feeling helpless. And also, if the mother is really anxious and doesn't know what to do, and she's always like keeping this child next to her, and she thinks that she can do it best because she's the mom, which is also really overwhelming, etc. So the husband or whoever the partner is
Yes.
can't actually even help, but has to be there for her. Yeah.
Yeah. Yeah. Layers upon layers upon layers of different kind of dynamics and nuances and difficulty. And then also we're bringing our own like family of origin stuff uh into that mix as well, so then we get moms and mother-in-laws and aunties and all that who want to kind of like be involved and see the baby and help, but their help is, I'm going to come hold the baby while you go do the dishes. Right? And so that's why and I'm very protective over this population. That's why I think it's so important to have some specialized training when working with this group, because there are nuances to it that aren't necessarily present when treating kind of your more traditional forms of depression or anxious distress.
Just as a question, have you seen any sort of like symptoms or signals that a mom can experience more dramatic delivery or having difficulties with becoming a mom beforehand, so during the pregnancy? Are there any symptoms or signs that we can look at?
Hmm, that's a good question. I think there are a lot of things that are risk factors for
Hmm.
perinatal distress, but it doesn't necessarily mean a direct correlation. right? I think people who go in to the labor and delivery experience completely blind, meaning they haven't done any sort of education around birth education, or or even just like online reading or something about like the potential um, hurdles or challenges or choices they may be asked to make. I think that puts somebody at a disadvantage. I'm myself, so I'm trying to keep my own personal bias out of this. I'm an information junkie, so for me, going into something like that, more is more, right? But that's not for everybody. But I do think nothing is nothing. And I think that that sets you up for a lot of just kind of being in a space of unknowing, which kind of, and uncertainty, which creates kind of a foundation for a traumatic experience.
Yeah, if we imagine that we go to labor and something happens, some sort of infection or something that you never thought of, and you now need to go through forced oh I forgot the word.
Induction?
Con- yeah, yeah, or something that is forced chemically as well, and
Right.
you didn't even thought about it, you never read about it, so now you just start feeling that your body's failing and something's wrong because you never even read that's actually happening. And I can imagine that after that you can feel a lot of guilt and shame, even though there is not reason about that.
Yeah. Yeah. So, in my experience with my oldest daughter, I went into labor about a month early, and because I had preeclampsia. I had no indication of that before going into labor. Um, so whereas maybe some other people at their checkups might start to see an elevation in blood pressure or other things going on, it really was. I went into labor spontaneously. It was so early, I didn't even think I was in labor. And so I did end up going to the hospital, and then I found out that I was preeclamptic and that I would be delivering that day. But it was helpful for me having the education that I had. And again, like some of it's because I'm an information junkie, but because I could like start to process like what was happening, and slightly anticipating what was happening before it was happening, if that makes any sense. So when they started to like check certain things, i I like knew like why they were checking certain things, and so it helped me to kind of mentally and emotionally prepare. And I mean like minutes, like 5 to 10 minutes, but it helped me kind of mentally and emotionally prepare for what I knew ultimately they were going to come and stand at my bedside and tell me. And I was grateful for that, to just have a little bit of working knowledge again, to be able to anticipate it, because I didn't feel so blindsided by the experience.
Yeah, I think this specific argument about being blindsided is really, really making everything difficult, because if something goes wrong, you are feeling helpless because you don't know actually what's happening. And when you don't know what's happening, you're starting to depend on other people that knows what's happening.
Yeah,
So you're not in control of the situation, and you can be really, really traumatized by it, or your reactions could be like it's the end of the world.
right, right. And so I think this is where anybody who's listening to this, who has had a child, knows your nurse will make or break your experience in the labor and delivery. Um, I can't speak for other parts of the world, but what happens typically in the States is the nursing staff is who is with you throughout your labor process, and then the doctor kind of comes in and checks on you every so often. But then it's not till like go time, when you're ready to deliver, that like the doctor kind of comes in with their like superhero cape on, delivers the baby, and it's like, yay, doctor! But like, yeah, like the nurses have been in the trenches with you the whole time, right? And so that's why it's so important for our medical personnel to be trauma informed, and trained to just anticipate anything that could come up during the labor experience. So things like explaining what's happening. Okay, we're checking your blood pressure because of this. We're checking this because of that, right? Um, Asking before performing a procedure. Again, like being checked, like for cervical dilation, is incredibly invasive experience, right? And so, just being asked permission, like, you have to, but even just being asked permission, like, gives you the sense of empowerment over what's happening to you, right? So I think those are, and they're very simple things of, okay, this is what's happening and this is why it's happening and we're about to go do this, or, oh, okay, I'm gonna check you now. Is that okay with you? Can I, I'm gonna put my hand here, I'm gonna put my, like that kind of stuff, like, is very, very helpful in the labor and delivery experience. Yeah. Yeah. So we
Yeah,
love
I
our
think
nurses. We love our nurses.
well, with that point being said, I think it's really important for practitioners to overall be educated, because from patient to patient, there is a huge difference, like what exactly is happening. And because I've heard that from other moms and also my friends that have been into labor, that what happens after the delivery and how the nurse actually reacts to everything is quite important because you remember everything at that time. You remember everything. Everyone says that, like, even one sentence that can be like just held it together or something that is not really emotionally supportive, it can make you feel really bad and you remember everything. So it is really important to be educated on how the woman is quite sensitive in that
Mhm,
situation, I imagine. I don't know.
mhm. Yeah.
But yeah.
Oh, you're so vulnerable. And you also remember the positive too, right? I had an angel of a nurse in my first birth experience, and years later, I mean, like, probably 8 years later, I was giving a talk in my role as a maternal mental health practitioner to a auditorium full of nurses who worked in postpartum and labor and delivery. And this woman raised her hand and asked a question, and I went, and I immediately started crying. And I said, "Oh my gosh, Laura!" I remembered her name, and I said, you were there, you were wonderful." Crying, right? Crying just at the sound of this woman's voice because she was angelic. I'm certain she didn't remember me. She's delivered hundreds, helped deliver hundreds of babies, if not thousands at this point. But I remembered her. So that, I mean, it does. You're right. It sticks with you both ways. The second nurse I had with my second was awful, and I remember her too. Yeah. Yep.
Yeah, and just as a question, in the US, how is it after you give delivery? Is Can the child be with you, or you have to stay up away from her? Him?
So much of that depends on the specific um, kind of practices or procedures in that specific hospital,
Mm,
and also kind of what happened during the labor and delivery experience. A lot of women who have this, and they get frustrated with this, is they if you end up having to have a C-section, one of the things that moments that a lot of new parents kind of fantasize about is delivering that baby and it being immediately placed on your chest, right? And that's not an experience that women who've had a C-section often get. That baby is delivered and then immediately taken over for assessment, wiped off, right? Wrapped up and then brought to mom, who's kind of like, what? Strapped on a table, right? With her arms down often, because she's, just been cut open.
yeah,
And this is why that education, I think, educating yourself and learning how to advocate for yourself and ask for things. Because there are some providers that will do that immediately on your chest, even after a C section, right? But moms don't know that they can ask for it. Moms don't know that they can advocate for it. So that's but that is kind of recapturing a piece of the labor that you fantasized about, even if a lot of it, the other, you've lost and you now have to grieve. Most people don't envision that
Yeah.
part, being kind of strapped down and in a cold, sterile operating room, right? But can we get this? Can we get that immediately on the chest? Because that can really, really make a difference. That can really make a difference. And again, help that new parent to feel empowered over parts of their birth experience where so much of it they've lost control over.
Yeah. Also, I can imagine if it's an emergency C-section and someone really wanted to have a natural birth, and an emergency C-section happens. So you maybe not that informed. So this could also induce a lot of trauma, I reckon. I don't know, but it just sounds like a really like a really common thing when I speak with women that have had gone through emergency C-section, so they didn't want it to be, but that happened. And because they've read everything about how to have a natural birth and they've been really in control of their health, they were doing everything correctly, but something happens and an
Mhm.
emergency C-section has to be operated. So everything changes basically after the birth from her expectations, I mean. Yeah.
Yes, yeah. And a lot of times with an emergency C-section, the support person can't even be in the room. There's not enough time, right? So now they've lost their support individual, their partner or whoever they've chosen to be in that birth experience with them. Um, And so that's why I think, I'm going to continue to bang this drum, right? I think like just educating yourself is so important, and knowing like if this then that, if this then that, so you can kind of start to create. And I think a lot of people, the anxiety of like, oh God, I hope, what if I have to have an emergency C-section? They kind of like don't want to go there mentally,
Yeah.
emotionally. That feels like really scary and overwhelming. And it can be, but it's going to be more scary and overwhelming if you don't educate yourself a little bit about some of those what ifs and lean into that distress now. Because boy, it's going to create bigger distress down the road if you don't. And one of the other things I really advocate for, it's not always financially an option for everybody, but is doula support. I think doula support is great because it supports both parents, right? And you've got somebody who like has been there, done that, they're educated to help you create your birth wishes. And notice I say wishes, not plan, right? Because if we get too connected to that plan, we're really distressed when it kind of goes out the window. But having birth wishes, and again, who can give you of again like and if this happens, here are your options, what would you like? And if this happens, here are your options, what would you like? Right. And then you can
Yeah.
discuss that with your provider before you're in a delivery room.
Yeah, I can imagine being really helpful if you knew that, just saying like, I don't really want C-section, but if something happens and it has to be procedured, I would prefer this and this and that, or
Yeah.
something like that. I can but the
Yeah.
thing is, like, a lot of women that I speak to, they say they didn't thought about it, or maybe I can imagine that they didn't want to read about it because they were really stubborn on the idea that they would have naturally
Yeah.
induced birth,
Yeah.
which also can be sort of a like maybe a stigma that naturally induced birth is the best for the baby and for the mom. So you should not have a C-section, and because of that, women are not even preparing to have an emergency C-section.
Mm-hmm. Mm-hmm. That's an amazing point to say how then women kind of feel like somehow they have failed because their labor didn't progress, or because they didn't go into labor naturally and they had to be induced, and it ended up with a C-section. And yeah.
As a last point, I would ask you to give some suggestions, like what to do if you just gave birth and you feel really awful. You feel awful. You feel that something's gone wrong, that your body failed. And I reckon that sometimes, most of the times, women would have physiological and emotional trauma. Not only emotional, but also your body would feel like you just had a surgery if you had a C-section. So your body needs to recover as well. What are the the main practices that women should do?
So I think now you're hearing a theme here. I think if we can predict it, we can prepare for it. So preparation before labor and delivery is key. There's a resource that I share with my clients. I hope it's okay that I share here. It's called the Postpartum Eco Map, and if you just look it up online, it should pop up. Postpartum Eco Map, and it you sit down with your partner and support people, and you make a plan for like who can visit, who can't visit, when they visit, what are they going to do, what are they going to provide, right? And I don't want folks to lose sight of when a baby is born, so is a mother. That mother needs as much mothering as this new baby. So yeah, grandma is gonna come because she's gonna want to see that new baby, right? And that's normal, right? Right? But who's gonna mom the new mom? Because she needs her mom too, or a adjacent support person to make sure she's being attended to, taken care of, healing, especially if she's had a C-section. That's major surgery. So having a plan for that ahead of time is huge. Now, in the postpartum period, we expect, because of hormonal ups and downs and crashes, right? And sleep deprivation and physical and emotional exhaustion in those first 2 to 3 weeks, to see like kind of emotional, ups and downs, right? Tearfulness and irritability and all that kind of stuff. But if you're feeling really awful most of the day, most days, right? That's when we want to reach out to get additional support. Additional support. So I would say, even in that first 2 to 3 week period, if you feel like something's really off, like I just don't feel right, reach out for help. Most people, their first stop is going to be their OB. Although I know in other parts of the world, which is lovely, there are people, home care, like nurses and aides and midwives who come to the home, which I think is amazing, right? But if it's happening in the time frame between those visits, like reach out to the obstetrician. All right, that's usually the first place that people will go to say, I'm not feeling okay. And then if after the first 2 weeks, again, 2 to 3 weeks, you're still feeling like really off, that's also a period of time that we say, reach out and get some help. Yeah. Don't wait.
Yeah.
The sooner we intervene, the faster your recovery emotionally will be. The longer it goes on, it takes longer to feel better.
And as a last question, can it have like a long-term impact if it's untreated, if you have some sort of perinatal disorder?
Yeah, so a lot of people have asked me, like, when, like, is it still postpartum depression 2 years later, right? And again, and a lot of my colleagues who are kind of like in the trenches doing this work, we say like postpartum's indefinite. Like once you've had that baby, then you are permanently in the postpartum period for the rest of your life, right? Um, but if the on and how we actually diagnose kind of medically, and this could be a whole nother podcast, right, is different from how we look at it as providers sitting across from clients who are struggling, right? So, according to like the DSM that we use to diagnose things, it's like in the first 4 months, but the onset can be after that point in time. So the folks that I work with, it's usually in the first year is when we would consider onset being postpartum. But if that's not treated in that first year, that can go on. That can go
Hmm.
on. Yeah. So
Yeah.
if the kid's 18, would we call it postpartum? Probably not. Right? We probably wouldn't. At that point in time, we'd probably call it a depressive disorder or a
Yeah.
generalized anxiety, right? But if its onset was in the postpartum period and it was never treated, right? It was never looked at or supported or treated. Well, I'm going to unpack that with a client because It's significant. The onset is significant.
I think that's a really essential point because most women would say because DSM says that and because we are put in boxes and diagnoses, we just have this period and if it's gone, it's not that. So something else is wrong with me and they don't know that the onset is from the postpartum period after giving birth.
Mhm.
And I think just this is a really important point that we as people that are working in the psychological field should also raise a lot because it's normal for other people to not be aware. It's us who we need to stop putting people in boxes also.
Yeah, yeah, but yeah, we're always postpartum. Yeah,
Okay, Stephanie, thank you so much for this lovely talk. It was really informative and I think it was really great. I enjoyed it a lot. I hope our listeners would enjoy it too.
great.
And yeah,
Thank you so much. I appreciate it. Anytime.
thank you. Bye bye.